My name is Britney Grayson. I am a pediatric surgeon at Bethany Kids Kijabe Hospital in Kijabe, Kenya. Kijabe Hospital is a 360-ish bed hospital in, we'd say, rural Kenya. We're only about an hour from Nairobi. We sit on the side of the escarpment of the Rift Valley, so a bit hard to reach, although a paved road has really helped that. For me, being a pediatric surgeon, our pediatric beds are about probably 80 to 90 of those 360 between our pediatrics ward, ICU, and also the nursery. So we really have a huge capacity to care for children. So we have 3 pediatric surgeons here, a full cadre of pediatricians that help us to co-manage a lot of these sick patients. So I would say access to pediatric care in Kenya is limited but improving. So specifically, we see a lot of children who are born with what I would consider more common congenital anomalies, which are previously called birth defects, a different way of saying that now. But we see a lot of kids who come from facilities where no one knew. They'd never seen what the child's problem was, so they certainly didn't know what to call it or how to treat it. So we are helping to address that by training pediatric surgeons here, and also the pediatricians are training more pediatricians and also clinical officers, which is like an advanced practice provider in the care of pediatric patients, but also specifically pediatric surgical patients. And so in doing that, we're able to scale up the pediatric care and specifically diagnosis and referral. So we can't put qualified surgeons and pediatricians in every hospital in Kenya quickly, at least. And so training some of these other providers to be able to diagnose and refer to us has been really helpful. Training is really integral to what we do here at Bethany Kids Kijabe because there are so few pediatric surgeons on the continent. And so in Kenya, actually, we have around 30 pediatric surgeons for 50 million people. The difference in African countries versus European and North American is that roughly half of the population is pediatric here, so 40-something%. So 30 pediatric surgeons is not anywhere near enough, but it's more than some other countries. So there's no pediatric surgeons in Burundi, for instance. The first one was just trained and he's setting up practice back there. There's one pediatric surgeon for all of Sierra Leone. There's one pediatric surgeon in Madagascar. And so we are really trying to address that, which is part of my calling and my work here. I was very fortunate to be trained by some awesome people in residency and discovered my own love for teaching also through that process. And when it comes to thinking about the problem of the lack of pediatric surgeons on this continent, I alone cannot solve that problem. I'm one person. I'm limited in the number of cases I can do in a day, in a month, in a year, and I'm limited in only being able to be in one location at once. And so being able to be a part of a training program allows me and all of us here to multiply our efforts and really feel like in moving forward, we are able to give more pediatric surgical care to the continent through training. And so that was really my draw here to Kijabe Hospital. I came here for the first time as a general surgery resident in 2015. So that was actually 8 years ago this month. I first set foot in Kijabe and I saw the mission of the hospital, the training of surgeons that was happening, and just really, really wanted to be a part. We are missionaries with Christian Health Service Corps, and what drew us to CHSC in particular was the way that the organization prioritizes the distribution of good medical care in Jesus' name. So it's very much what we do here. I would say I don't work in an area of unreached people, for instance, which a lot of mission agencies are rightfully focused on. But my graduates and the people that we train are able to go to areas that I could never dream of going to and having an impact and an influence for the Lord in a way that I could never have. And so really, I think the decision to join Christian Health Service Corps was because of the way they prioritize my work as my ministry, which is very much how I see it and how I live every day. So we've been really happy to be a part of that team and have, just be a part of the family of people who are all doing the same thing, providing quality, in my case, surgical care and training in Jesus' name. Christian Health Service Corps is really a family business, I say, a family organization. When we went to our orientation, it was, the expected mix of HR and setting up, all of the different, our budget and things like that. But there was also just such an intentional time of pouring into us. So talking about subjects like lament, what happens when you lose a patient. You can't do it all, nor can you save everyone. God controls life, like God created us, and all life is under his hand first and foremost, which is a message that me and probably most doctors need to hear a lot. And so I have really appreciated that aspect of my onboarding, if you will, and also training really through our mission agency to help make me stronger in this work. In trying to follow the Lord every day in our work, which really is something that we all want to do, right? But I just have perhaps more of a freedom to do that working here in a Christian mission hospital. And so I've been able to have experiences where I share a verse in theater, the operating room one morning, and even one of the scrub students came to me one day and she said, I've never seen anybody do that, And so I think definitely it's a big responsibility to model good behavior, to model what it means to be a Christian and a surgeon. I don't claim to have that down, but I just try my best every day. And I think whenever you take intentional time with families, it shows them respect. And that's not always found in it's not always found in society, right? But it's also not always found in hospitals and in clinics around here. Sometimes parents are just kind of ignored. They'll just take the baby and do what they need to do and return the baby, right? And so in taking that extra time to sit with a parent, to make sure they understand the diagnosis, make sure they understand how their child is doing that day, those opportunities, I think, are what makes the difference in the care that we provide here at Kajabe Hospital and Bethany Kids. And it's the reason that so many of our patients that come to us say, oh, I'm here because I know so-and-so. I'm here because someone in my village brought their child here and you cared for them well. And so our referral network through the country is really that. It's our patients going out and talking about their experience here. And to me, the difference is Christ, plain and simple. Here on the continent, there are not a lot of women in medical school, although those numbers are rising. But when you look at the percentage of women in medical school, and then the percentage of women who go on to be surgeons, I think it's like 7% of surgeons on the continent are women. And so through working with these ladies who are in training here now, it's been really humbling to learn that basically all of them have been told not to do this. So here are these women who are working dawn to dusk, more than that, right? They are giving so much of their lives to the practice and learning of surgery to provide that care in Jesus' name. They've all been gifted from the Lord, right? That doesn't just come from somewhere else. They have these gifts from the Lord, and they've been told not to use them because that's not what the Lord's calling on their life is. They need to go get married and have children. And I'm not diminishing that at all. I'm saying you can have both. And so it's a huge responsibility, but it's also an incredible opportunity to encourage these women to make sure that they don't, for any reason, give up or, let the pressures of society take over, that they finish strong these training programs and they go and become the women who are encouraging other women in medical school and even before to do this. And I think, when we think about the Pan-African Academy of Christian Surgeons, for instance, PACS exists in part because of this idea that surgeons should look like the people they're treating, right? Train African surgeons in Africa. So I would posit my personal opinion is that we can't do that without also including gender in that conversation. We can't do that without also having female surgeons, intentionally bringing them into our programs, supporting them in the unique challenges that they have, both in terms of societal pressure for our married trainees who are having children, supporting them through that, having healthy babies. It's all so important in developing that person in her calling and in her career. One of my favorite things to do as a medical missionary is respond to the somewhat large number of requests I get from high school students, undergraduate students, medical students, residents who say, I'm interested in this kind of work. What can you tell me? I love those conversations because it gives me so much encouragement to know that there are people coming up behind me to join me and us in this work. And what I typically tell them is to not be afraid to not do what the world expects of you. So the world expects me to live in the US, work in an American hospital, make a lot of money, probably drive a fancy car. You think about these stereotypes of doctors and surgeons. The world might expect me to have a God complex, right? To think that I save the world. And the best part of my life is getting to live differently than that. It's getting to say that material possessions do not define me, that I don't control life, God does, and I'm only able to do what I do through Him. And so basically that's pretty much the message I try to give everyone I talk to is don't be afraid to give up what the world expects of you in pursuit of something that's even greater.